From the JAMA Network, this is JAMA Ophthalmology Author Interviews. Conversations with authors exploring the latest clinical research, reviews, and opinions featured in JAMA Ophthalmology.
Hello and welcome to our listeners around the world. You're listening to JAMA Ophthalmology Author Interviews. Thank you for joining us. I'm Neil Bressler, Editor-in-Chief of JAMA Ophthalmology, and today we're going to look at an original investigation on standardizing retinal vasculitis terminology with consensus definitions from a Delphi panel of experts in this field from around the world. Joining me to discuss this publication are two of these experts, including first, Dr. Rupesh Agrawal, the corresponding author for this investigation. Dr. Agrawal is a professor of ophthalmology with the National Healthcare Group Eye Institute in Singapore. Rupesh, thank you for joining us.
Thank you, Neil, for having me here.
Also doing this about 13,000 kilometers from Singapore is the first author of this publication, Dr. James Rosenbaum. Dr. Rosenbaum is the Chief of Ophthalmology Emeritus at the Legacy Devers Eye Institute in Portland, Oregon. Jim, thank you also so much for joining this podcast.
Neil, it's an honor. Thank you.
Rupesh, maybe I could start with you. Could you tell our audience, just before we get into these definitions, what's a Delphi panel and why did you choose to use that approach to come up with these consensus definitions?
Thanks, Neil, for asking this question, and I'm glad that you asked this question. So one of the challenges which we have with certain fields of medicine is that there is a lot of ambiguity and we don't have very clear guidelines about some of the terminology or some of the approaches in terms of medical treatment as far as medicine is concerned. So in those contexts, the Delphi panel can be used. It is a way, it's a methodological way, wherein using certain experts and certain set of questions, you can go through multiple rounds of something like you call it as a survey and then come to consensus definition based on it. And it is used particularly in the context of where there is lack of evidence based on the published literature or the expert opinion and all. And this is where the Delphi panel is used. Thank you.
And what do you do in between those rounds? Do you get together and say, oh, this problem didn't work? Or do you just say, we're going to ask it again? What happens in between round one and round two?
Yeah, so that's a great question. And once again, the Delphi panel starts with identifying the group of experts who should be different areas of expertise. Then they set up a set of questions which will be asked in the round one. And the round one is conducted where all these panelists come across and then they go through this set of questions. Most likely it is done in live or sometimes over the Zoom when all these questions are discussed. They all each mark individually. After that, once the answers are given, before we go into the round two, so what we do is we identify the statement which have received a consensus, and this is preset by the steering committee, by the Delphi panel committee. So this consensus can be 75% or 80%. So those questions or the statements which have received a consensus, those are taken off, and the statements which are remaining are further deliberated within the group. So between the two rounds, Delphi 1 and Delphi 2, there's a lot of discussion, and that I call it as a food for thought. So people discuss, people deliberate, and then again the refinement of these statements are posed in the round two, and the experts again go through the round of questions. So if it is sorted, we close at round two, otherwise we go to round three also in some cases.
And Jim, let me turn to you again. Before we get to what the definitions were, I just want our audience to understand the whole methods here. So you had 27 international experts who participated in this Delphi process. My question is, how do you identify those 27? What characterizes those individuals as having the experience or the expertise that makes them the ones to make this consensus definition?
The question of retinal vasculitis extends to many different fields. So we needed experts in pathology. We needed experts not only in ophthalmic pathology, but vascular pathology. We needed imaging experts. We needed rheumatologists. We needed uveitis experts. And we wanted geographic diversity. So we had an executive committee that included Rupesh and myself and Vishali Gupta and Sapna Gangaputra. And we selected for diversity. So we had 6 continents represented and we had multiple fields represented. And I think I omitted that we also had methodologists. So Rupesh, for example, is a retina expert and an expert in the Delphi methodology. So we were covering our bases as best we could.
And Rupesh, Maybe I could turn to you now just to help me understand. So there was this standardization of uveitis nomenclature, this SUN working group, and I know Dr. Rosenbaum was instrumental in putting that together. And they established, like 2 decades ago, some uniform terminology that really are used today for reporting uveitis or investigating uveitis. How's that worked out, Rupesh, from your perspective? And then why did you perceive you needed to go on and do some new things? What changed in the field? So how's it worked so far? And what went on externally that said, we need to approach some little gaps here again?
So once again, as we practice uveitis, all the uveitis experts worldwide follow SUN criteria, which is standardization of uveitis nomenclature. And the original SUN criteria was published in 2005 and the updated one very recently in 2021-2022. Now both the SUN 1 as well as the SUN 2 updated do not include a very exclusive definition or description about the terminology related to retinal vasculitis. So very vaguely in 2005, the SUN panel were unable to reach the agreement related to precise definition of retinal vasculitis. So they broadly classified it as a descriptive term for those situations in which there is evidence of ocular inflammation and retinal vascular changes. So that was a very broad one, and we were not able to specify what exactly is happening and how do we characterize further. And that was one of the stimulating point to start with, where Professor Rosenbaum came up with this dilemma where we were not able to understand based on this definition. And that is where the group were brought together through IUSG, International Uveitis Study Group, when Dr. Vishali Gupta was involved as a president of IUSG. And this group came together to further brainstorm about how do we approach about resolving this terminology dilemma.
So Jim, you've gone across both of these efforts. What changed and what allowed you to approach these new definitions now?
Well, there was a recognition in SUN, as Rupesh said, that retinal vasculitis was a troublesome term. And the SUN group sort of threw up its hands and said, we're just going to be vague on this one. And over 20 years has passed. We're smarter. We're still not smart enough. Our ability to image those vessels is improving, but not perfect. But I personally have encountered lots of ambiguities with the term. So I'm a rheumatologist by training, even though I've been a chief of ophthalmology. Rheumatologists speak a different language from ophthalmologists, and I hear from rheumatologists complaints about ophthalmologists, and I hear from ophthalmologists complaints about rheumatologists. But one clear-cut example is vascular leakage. I mean, if vascular leakage is tantamount to vasculitis, then everyone with pedal edema has got a vasculitis in their feet, and that's just not so. So it's confusing because leakage is useful in following the activity of retinal vasculitis, but leakage by itself should not be used to define retinal vasculitis. I could go on with how these ambiguities really affect care and outcomes. So it's a big problem, and we think we've made a step forward.
No, that seems so important to me because just in speaking from a retina perspective, somebody with diabetic macular edema certainly has vascular leakage, but I wouldn't start claiming that they've got vasculitis and inflammatory cells all over the place. Jim, one of the things that might strike some of the people as they're reading this is there did not seem to be a specific separation of, let's say, arteritis from venulitis. Was that discussed by the group? And was that a purposeful omission, or it's just something I shouldn't need to worry about?
Neil, it's a great question. I think we have more work to do. There is a difference between a phlebitis, an arteritis, and a capillaritis. And Rupesh may want to comment as well, but I thought we didn't have enough information to draw distinctions. So we're going to get smarter in the future, and we can address that in the future, but we elected not to touch it on our first pass.
And Rupesh, technology and imaging continues to rapidly change in the ophthalmology field. Did you want to comment on that as well as to what the limitations are so far?
So first of all, to continue with Dr. Rosenbaum's comment about the arthritis versus phlebitis and all. So there are quite a lot of work need to be done. But first we wanted to establish the foundation of what is the vasculitis called to be. And then eventually we are intending to look into the first order vessel, the second order vessel, the third order vessel, leave aside just the veins and the arterioles and all, because all those things can eventually make a difference in the eventual diagnosis. But first we need to get the basics right. Now, I believe technology has a big role to play, particularly with the artificial intelligence slipping into every single discipline. The group is even thinking, how does all this technology, whether it is a imaging technology or any of the image acquisition or image processing technology, how it can work out. But as it stands today, still the gold standard which our group identified is still the fundus fluorescein angiogram, still the color fundus photograph, which too we have been using it. But if you talk about OCT or OCT as it stands today, it's still not helping us define or differentiate vasculitis from vasculopathy or any other condition. So we have a work which we need to do, and hopefully this research will probably lead those technology to evolve and come up with the new ways to identify the true vasculitis.
And Rupesh, as Jim said, we could go on and on with all the specific definitions, which we're not going to do now, but I want to highlight another one that you and your group focused on, and that was the need to separate out inflammatory from non-inflammatory vascular disorders. Why was that so important in revising or creating these new definitions?
Yeah, so that was one of the other contentions, because there are certain conditions which are predominantly inflammatory in origin, whether it is the ocular inflammation or the systemic disease inflammation which is driving the disease pathology, whereas there are certain diseases which are not necessarily inflammatory in origin and which also can make a difference. And the reason we wanted to classify these two separately, along with also infectious and non-infectious retinal vasculitis as well, because the treatment can be quite different. Particularly the people nowadays in the era of intravitreal agents and all, where people are giving, and also the biologics, we wanted to kind of understand people to think about it before they start administering one of those invasive forms of therapy, or even for that matter biologics. If we are able to differentiate this from the imaging feature, even if not in immediate future, but hopefully in the near future, where with the new technology they can differentiate, we'll be able to guide the treatment better. So that was the idea of getting these terms seeded now itself while we are coming up with this definition.
Jim, you want to comment on that further? I saw you shaking your head. Yes, we don't have our audience in the broadcast booth here, but I'm letting them know you're agreeing that this needed to be addressed.
Yes, absolutely. So, Neil, as you said, diabetes could mimic a vasculitis. Hypertension could do it. Sickle cell anemia could do it. Arteriosclerosis could do it. And as Rupesh said, it would be a disaster to treat entities like that with immunosuppression. So we really hope that people will take note and do their best to communicate with internists and rheumatologists and other specialists to distinguish true inflammatory disease from non-inflammatory disease.
And Jim, what's the next step? Does this go out there and people say, it worked, it didn't work, I need more revision? Does it work in the States but not in Singapore? Does it work in Europe but not in South America, with different entities causing these various uveitis? What happens next now that these are going to be out there?
Yeah, great question. So 27 experts is a lot, but it's not 300 experts, and getting consensus and getting adoption. So one of the goals that I'd like to see would be to have a Zoom meeting with a much broader group to see if the 95% consensus that we got among 27 can be reproduced in an even larger group. I think that we can use AI to see if we can teach it to recognize retinal vasculitis. I think that there are clearly additional steps, and we are dependent on technology. So to a rheumatologist, a vasculitis means the vessel wall is infiltrated by leukocytes. We can't determine that now with our current technology, but adaptive optics and advances in OCT angiography, et cetera, we're going to be able to firm up these definitions and maybe discard the definitions. In rheumatology, classification criteria for lupus and rheumatoid arthritis, those get revised periodically, and I'll be surprised if our definitions don't get revised with time.
If I wanted to add a little bit about the validation on the real-time data set. So parallelly, we were collecting also the data of the patient with the retinal vasculitis from different experts and the different contributors. And we haven't really gone into the publication stage yet. And we were just trying to analyze 1,100 cases of supposedly enter with that current understanding of retinal vasculitis. But what we are finding based on these definitions, which we are group have come up with, that the concordance with these existing definition and that the data entered is very low, and that something is an eye-opener. And it was also an eye-opener when we wrote 4 systematic review on retinal vasculitis and all published in Ophthalmology. All the literature was all over, when we come up with this definition. So it was one of the most challenging systematic review which we ever published, because it was very, very difficult to get the definition and the concordancy between the two different publications, even from the same author.
Well, this has been an exciting step, and I hope it gets our listeners to take a look at what you've been using, and more importantly, to start to see if they can use those definitions and how it applies in our clinical care, education, and research as well. I'm Neil Bressler, and I've been speaking with Dr. Rupesh Agrawal and Dr. James Rosenbaum on standardizing retinal vasculitis terminology with consensus definitions from a Delphi panel of experts in this field from around the world. The authors note in their article that the consensus definitions from these efforts may improve consistency in clinical communication, research reporting, imaging interpretation, and future development of other standardized diagnostic and AI-based approaches for retinal vascular inflammatory disease. Rupesh, thank you again so much for joining us from Singapore.
Thank you so much. It was an honor.
And Jim, thank you also for your efforts with the original Sun Working Group, and now on these efforts to standardize these definitions, now regarding retinal vasculitis and all these related vascular inflammatory conditions. Jim, I really thank you so much.
Thank you. This was a team effort, and it's good to be part of the team.
Absolutely. You can find a link to the article in this episode's description. This episode was produced by Shelley Steffens with the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com or search for JAMA Network wherever you get your podcasts. Thank you, everyone, for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.